What is anemia? Interesting about science and medicine, prepared by editorial team of a All Scientific Channel. As you know from biology class, our body requires a constant supply of oxygen to maintain good physical condition. Anemia is directly related to this need. The main causes of anemia are a decrease in the number of red blood cells, low hemoglobin content in red blood cells. The severity of anemia can vary from mild to critical. To understand the disease itself, it is important to consider how blood circulation works. Typically, the heart pumps carbon dioxide-rich blood to the lungs, where the hemoglobin from the red blood cells binds with the oxygen introduced into the body during inhalation. From there, the oxygenated blood is transported to all cells of the body. Problems with oxygen supply to cells occur when the body has too few red blood cells. Because this type of cell has a lifespan of only 120 days, the body is forced to constantly renew them. Anemia can result from significant blood loss or if certain factors inhibit red blood cell production or even destroy them. If the amount of hemoglobin in red blood cells is too low or exhibits certain abnormality, anemia is also inevitable. There are over 400 known types of anemia in medicine, many of which are, of course, very rare. Characteristic symptoms of anemia are pallor, weakness, nausea, shortness of breath. Many factors, including heredity, can contribute to this condition, but in most cases, anemia is caused by poor nutrition. Depending on the type of cause of anemia, this condition may require medical supervision, or if poor nutrition is the case, a healthy diet may be necessary. Symptoms of anemia are weakness, fatigue, feeling unwell. Moderate anemia is characterized by following symptoms: blood into the lips, paleness, skin, gums, mucous membrane of the eyes, crease in the hands. You are dealing with severe anemia if you have the following symptoms: shortness of breath, dizziness or fainting. Pernicious anemia, which occurs as a result of vitamin B12 cobalamin deficiency, is characterized by following: burning sensation in the tongue, smooth tongue, balance problems, stinging in the joints, feeling of confusion, depression, memory loss. Other possible symptoms of anemia: headache, arrhythmia, difficulty concentrating, loss of appetite, insomnia. When should you see a doctor if you have anemia? If you notice symptoms of pernicious anemia, this condition can damage the spinal cord. If you have been taking iron supplement and experience the following symptoms: seizure, lethargy, jaundice, fever, bloody diarrhea, vomiting, you may be dealing with excess iron in the body. Caution: excess iron in the body can cause serious complications, especially in children. Causes of anemia. The main causes of this disease are chronic blood loss associated with the following disorders: digestive system tumors, hemorrhoids, stomach ulcers, alcoholism, poor nutrition, poor absorption of minerals and vitamins in the body. Anemia in alcoholism is associated with alcoholic preferring to drink more than eat, which causes a deficiency of various vitamins in the body. Causes of iron deficiency anemia. Iron deficiency anemia is the main form of anemia on our planet. The disease is caused by a lack of a chemical element iron, which results in the body producing less hemoglobin. A deficiency of iron, folate, and vitamin B12 can cause anemia. Iron deficiency is primarily due to poor nutrition, but there may be other factors. Women that lose large amount of blood during menstruation have lower iron level in their body than other women. Pregnant women or breastfeeding mothers may also have low iron levels because they transfer this mineral to the fetus or infant through the breastfeeding. Iron deficiency can also occur in patients who have had part of their stomach removed, which impair iron absorption. Causes of megaloblastic anemia. In this condition, red blood cells become very large. The following factors are causes of this type of anemia: folate, vitamin B9 deficiency, cobalamin, vitamin B12 deficiency. Hypovitaminosis of these vitamins is critical for normal red blood cells production. Folic acid deficiency anemia. The most common megaloblastic anemia is folate deficiency anemia. This condition occurs in people with vitamin B9 folic acid deficiency. Vitamin B9 deficiency can be prevented by consuming several hundred grams of spinach. The problem is exacerbated if patients are unable to absorb adequate amount of folate. Some factors can negatively affect folate metabolism: inflammatory arthritis, Crohn's disease, certain medication, sulfasalazine used to treat ulcerative colitis, alcohol abuse. Why does pernicious anemia occur? The most common form of anemia due to hemoglobin deficiency is pernicious anemia. It occurs when the stomach fails to produce a substance capable of binding vitamin B12, thereby impairing its absorption in the small intestine. This type of anemia is rare but primarily occurs in the elderly. Vitamin B12 deficiency is less common because the body typically meets its need by consuming eggs and meat. Typically, cobalamin deficiency is associated with the body's inability to absorb this vitamin. Inability to absorb vitamin B12 is most often seen in patients who have undergone gastrointestinal surgery. What is hemolytic anemia? Hemolytic anemia results from genetic damage to red blood cells, which causes them to be destroyed prematurely, especially due to infection. In some cases, these red blood cells die under the influence of a body's immune system. Some types of hemolytic anemia are inherited, while others are caused by other factors. What is thalassemia causes anemia? Thalassemia is a type of genetic anemia characterized by the body's inability to produce sufficient hemoglobin. In the Mediterranean region, there is a type of thalassemia in which the body produces small, vulnerable red blood cells. This type of thalassemia only occurs in people in whom both parents carry the gene of this disease. Sickle cell anemia. Sickle cell anemia is a genetic disorder that most often occurs in people of Mediterranean or African descent. This disorder is characterized by the body producing sickle or crescent-shaped red blood cells instead of normal oval ones. Deformed red blood cells contain less hemoglobin, so they can transport less oxygen. Their shape also makes it more difficult for them to pass through capillary blood vessels. These red blood cells can clog some blood vessels, causing a painful crisis. Diagnosis of anemia. Before starting any treatment, you should first determine what type of anemia you have. For this, it is recommended that you consult a doctor. The doctor will analyze a blood sample and determine the type of anemia and possible causes. Treatment of anemia. Treatment options for anemia range from simply dietary change to hormonal therapy and, in several cases, even surgery. Alternative medicine practitioners typically rely on dietary change and improve circulation. How does modern medicine treat anemia? Once the doctor has identified the cause of anemia, they can begin treatment. Treatment of iron deficiency anemia. To treat iron deficiency anemia, your doctor will likely recommend iron supplement and dietary change. Because some iron supplement can cause intestinal upset, it is recommended to take iron supplement in form of ferrous gluconate rather than ferrous sulfate. Of all iron supplements, ferrous gluconate is best absorbed with fewer side effects. Choose supplement in the form of solution and syrups if you have that choice, avoiding tablets. Also avoid enteric coated iron supplements as they will reduce the amount of iron your body receives. Caution: iron is highly toxic in large doses. Overuse of iron supplement can lead to excess iron in the body. Symptoms of iron toxicity include abdominal pain, intestinal disorders, sometimes fatal, especially in children. Taking iron compounds is especially dangerous for patients with hemochromatosis. This is because hemochromatosis patients absorb more iron through the intestinal wall than healthy individuals. Therefore, consult a doctor before taking any iron supplement. Treatment of anemia due to vitamin B12 deficiency. As explained above, this condition is caused by the body's decreased ability to absorb cobalamin vitamin B12. To treat the condition, vitamin B12 injections should be taken periodically. Many patients have learned to administer the injections themselves. Surgery may be necessary if a patient has anemia due to blood loss. Before deciding on surgery, the doctor determines the possible causes. Surgery may be necessary for intestinal bleeding, which is one of the main causes of iron deficiency anemia in men. Other treatment may also be prescribed for anemia: blood transfusion containing red blood cells, hormonal injection to accelerate red blood cell production. Caution: for women should only choose hormonal injection in exceptional cases, as this medication can cause various side effects. Caution: women should only choose hormonal injection in exceptional cases, as this medication can cause various side effects. Severe cases of thalassemia require regular blood transfusion through the life, and other hemolytic anemia may require surgical removal of a spleen. Traditional medicine uses it to treat anemia. Traditional medicine treats anemia in the following ways: improving circulation, improving iron absorption, stimulating digestion, changing your diet by adding food rich in iron or vitamins, treating anemia with Chinese folk remedy. According to Chinese medicine, anemia is a sign of a weak spleen. A healthy spleen is believed to maintain the integrity of the blood vessels and preserve healthy blood, while a diseased spleen is responsible for production poor quality blood. Treatment typically involves stimulating the spleen as well as acupuncture and herbal medicine. Herbs recommended by Chinese medicine for treating anemia include Asian ginseng, which is excellent for toning the body and eliminating fatigue associated with anemia; Angelica sinensis, which has been used for thousands of years for menstrual bleeding. A remedy based on Angelica sinensis and Rehmannia glutinosa is recommended for anemic patients with a lowered complexation. A remedy based on Asian ginseng and astragalus is recommended for very pale anemic patients. Herbal medicine for anemia. In folk medicine, consuming bitter substance is believed to optimize digestion and improve nutrient absorption. Yellow gentian. Yellow gentian is a bitter tasting plant used in Europe for various digestive disorders, including anemia. Yellow gentian can be consumed as a tea or tincture. Both forms are available in a specialist store and pharmacy. Dandelion. Dandelion is also considered very beneficial for anemia due to its high vitamin and mineral content. Plant useful for anemia. Parsley and needle are very beneficial for anemia due to their high iron content. The following herbs are used to stimulate digestion: anise, caraway, coumarin, linden, licorice. Nutrition and diet for anemia. The most reliable treatment for anemia is dietary changes. Correcting iron, cobalamin and folate deficiency help reverse anemia. The best source of irons are considered to be bread and fortified cereals, rice, shrimps, almonds, dried fruits, poultry, liver, lean red meat, beans, tomatoes, broccoli, carrots, potatoes. Keep in mind that iron is better absorbed from animal foods than from plant foods. Study has shown that copper and vitamin C, ascorbic acid, have a positive effect on improving iron absorption in the body. This is why drinking citrus juice with meals is recommended. The following foods have been shown to impair iron absorption: black tea, calcium supplements, antacids, caffeinated beverage, carbonated drinks. If you have a folate deficiency, consume more of the following foods: breakfast yeast, wheat germ, milk, eggs, liver, green vegetables, citrus fruits, mushrooms, pumpkin. It's important to remember that folate is destroyed by heat in light, so try to consume as many fresh fruits and vegetables as possible. What can be done at home for anemia? A key step in treating anemia is a balanced diet. Depending on the type of anemia, consume the appropriate foods. Monitor the foods you consume. Check their ingredients and find out if they contain the required amount of cobalamin, vitamin B12, folate, vitamin B9 and iron. Avoid caffeinated beverage, tea, coffee, cola, which meals if you have an iron deficiency, as they impair iron absorption. Tannin in black tea also negatively affect iron absorption. Citrus juice are recommended because they contain a lot of vitamin C, which promotes better iron absorption. If you are not already taking vitamin supplements, now is the time to consider them. Caution: before taking any iron-containing vitamin supplements, consult your doctor. Excess iron is very dangerous to your health. Anemia prevention. Avoid excessive alcohol consumption. Alcoholism reduces the likelihood of proper nutrition and reduces the intestine's ability to absorb folate, which is necessary for red blood cell production. Take daily vitamin supplements to meet your body's vitamins and mineral needs. Thank you for your attention. This material was prepared by editor of the page All Scientific. Attention, this material is for information purposes only. When observing very unusual symptoms, it's recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.